Hi, Dr. Regina Rodman here, and we are here today to talk about Renuvion skin tightening and some of the risks that are associated with it. Now, you all may have seen that recently there was an FDA warning against Renuvion subdermal application because there were some concerns about burns and some adverse events that had happened. While I absolutely take that very seriously, I also am not surprised because it is a very powerful device. I think it's probably the most powerful device on the market, and so I'm not surprised if there are people who are not trained or not skilled in how to use the device that things can go wrong. So I'm going to talk a little bit about some of the risks and then what I do to avoid those risks and why I still think this is probably the best minimally invasive procedure for skin tightening that's available today. So with Renuvion, what I do is actually a 3-part procedure. So what I do is through 3 small stab incisions. So these are small, about 5 or 6 millimeters here, and then about a centimeter, 10 millimeters underneath the earlobe, so behind the earlobe. So these are completely invisible. This one is right behind the fat pad in the chin. Everyone has a little crease right there. I put that incision right in that scar. All 3 of these heal really, really well. They're barely visible once they're healed. First thing I do on almost everybody is a little bit of liposuction to address the fat. We all gather a little bit of fat here under the chin. If I have patients that are very thin and don't really have a lot of fat, I still pass the lipo cannula a few times just to create some tunnels under the skin, which allows the wand to pass more easily. It also opens up some of the channels so that the risk of gas being trapped under the skin is less. And so that is something that has been reported, is that patients have crepitus or gas trapped under the skin, or like an area where a big kind of collection of gas happens. Allowing channels for the gas to leave the area is really key, and that's something that I think that I'm pretty well trained in and that I do well. So first we do a little liposuction, as much or little as the patient needs. Then we pass the Renuvion wand. So this is a helium plasma skin tightening device. It goes under the skin, contracts the dermal septal bands. So what it basically shrink wraps the skin to the tissue below it. So this isn't really a lift, this is more of a shrink wrap. So this procedure is best for patients who have mild to moderate skin laxity, who don't need a big skin excision, who don't need a lift, just want this tightened up. So it can be great for patients who have had a jaw reduction and just want the skin to shrink down, or for patients who are, say, 35 to 50, 55, who are starting to get some laxity and just don't want it, but don't really need a full facelift. Now, the way to know if you're a candidate and if this is a good procedure for you is to come and see me for a consultation. So we do consultations virtually, online, as well as in person. So I'm able to just get a good assessment and a good feel for the patient's skin and like what they're actually able to do. Some patients, a facelift is what they need. It's really the only thing that's going to help them. And I try to guide patients whichever way I think they're going to get the best result. But for patients who need the Renuvion, like I said, it contracts the dermal septal bands, helps shrink down the skin. So I do that from each of those ports. So we can do the neck, the submental area, and we can actually do a little bit of the jowl and lower face. People will often ask, well, can you do my forehead or can you do my cheeks? No, we can't, because literally the device is too powerful. So it is safe for the neck. It's safe to do a few passes in the lower face, but it is too powerful. There's too many nerves. There's too many important structures in the rest of the face. So we don't use it, at least as of now, like in the cheeks and in the orbits. Then the final thing that I do is a little suture mini lift. Now this is not a skin excision lift, but this bites the platysma or the neck muscles and just gives it a little lift, which just helps give a little definition at the back of the jawline and in the posterior part of the neck. Now why I think this is nice is because through this procedure, I'm addressing 3 layers. We're addressing the fat with the lipo, we're addressing the skin with the Renuvion, and then we're addressing the muscle with the little mini lift. So still all done in the office, takes about an hour and a half, but I think gives a better result than some of the other devices that are just addressing skin alone. Now, anytime you're using more energy and doing more things, there are more risks. So with the Renuvion, there is a theoretical risk of burn. I have read about this. I personally have never seen this happen. The good thing about the Renuvion is the properties of helium are such that the helium plasma releases a significant burst of energy, but the helium cools down very, very quickly. So it heats up really quickly and cools down really quickly. It reaches its peak temperature and then cools back down in less than 1 second. So it reaches its peak temperature, I think, in like 0.34 seconds and then cools back down. So what this means is that it delivers a lot of energy very effectively, but because it cools down so fast, the heat does not have a chance to spread. So I always have my hand on the outside of the skin and I can feel it heating up a few degrees, but it never feels hot. So it is heating up the underside of the skin really quickly, but it cools down so fast that the heat actually doesn't spread to the skin. It doesn't spread to the deeper structures. And so I think in that way, it's actually more safe than some of the other devices that use heat and energy because the thermal spread is so low to the skin. So the risk of a significant burn, I think, is really low in skilled hands. Like I said, the other risk that I have read about, but I have never seen, is a significant gas buildup under the skin. Like I said, I create a lot of tunnels with the liposuction to help the gas to egress. I've never seen a big collection of the gas. I also run the lipo cannula one last time after the Renuvion to help suction out any gas. Patients may notice a few little Rice Krispies under the skin, but they shouldn't have any big area of gas collection. Any surgery, anytime there's a risk of bleeding, that is one thing I have seen happen, especially with like more aggressive liposuction. We put some numbing medicine in that also helps to shrink and contract the blood vessels, but any surgery, anytime there's a risk of bleeding. The neck is super vascular. There are some big blood vessels in the neck, even just, around the skin. So there's always a risk of bleeding. So I do recommend that patients stay nearby for 2 nights after surgery or after a procedure, just in case something happens. I want to be the one to take care of you. So staying nearby is helpful just in case something bleeds. I do also have patients wear a compression bandage, so you have to wear this little wrap around your face that helps shrink it down and minimizes the risk of any like oozing after the procedure. Also, any surgery, bleeding, scarring. These scars are super small and heal really well, but if they don't, I really encourage patients to come back and see me to make sure that their scars are healing the way that they want. If they don't, usually we can just inject a little Kenalog in that area. It helps soften that scar up and helps it to heal really nicely. And then the final risk of infection. This is also not impossible, but really rare. The helium plasma, the properties of it are such that it kind of burns off any bacteria that are in there. That doesn't mean patients can't get infected, but we do have people start an antibiotic the day before and continue for a few days after to minimize any risk of infection. Other risks with the Renuvion is fibrosis, or basically over treating the area. I am actually working on a protocol on a research project to help determine the exact amount of energy that we recommend for each area of tissue treated. We have some good ideas based on previous trials, but I think we can be even a little bit more precise. I've learned just from doing like over 100 of these procedures how much needs to be done, how much energy needs to be delivered to each area of the tissue, and then I'm working on documenting that to create some guidelines for other people. So I think Renuvion is a great alternative for people who don't really need a facelift yet, but aren't really willing to wait until it gets that bad that they need one. It can be done in the office, about an hour and a half. And patients generally need only a few days off of work. You may have some bruising and swelling, so you want to take a few extra days. But as far as like pain and ability to go back to work, patients usually, if we do it on a Friday, if they work from home or they're wearing a mask, can generally go back on Monday. Patients that work physical jobs or on their feet, maybe want to take a few more days, but generally patients feel pretty good by about a week. So if you're interested, give us a call and we will help to decide if you're a good candidate.